Okay, hi, can you hear me? And I usually go over, so I know I can't ask me questions. Please ask me questions. And my name is Sonja Burns, and I wrote Rider 56, and I will send out what I originally wrote before it was muddied by another legislative office. I'm glad we got the clarification on the and or. I wrote Rider 56 based on the state auditor's report on competency restoration services. I, along with NAMI Texas and the Texas Jail Project, got Senator Perry to include in SB 6077, the 88th, a study of competency restoration services. We said it had to be an outside entity that looked into it. We got the state auditor to do it. It was unfortunate because it did say something about a forensic hospital, and many of us were disappointed that Health and Human Services was not proactive in discussing the IDD population because they are fast growing in our carceral settings. I also based that on Dr. Jeffrey Matthews' work. So the goal is to really address the population needing something in between hospital level care and community placement. I am happy to discuss this with anyone and everyone. I've been working on it for years. But also, and you'll see it in the original language, to really innovate within things we're already funding. We have HCS, we have HCBS AMH, and I know Dr. Jeffrey Matthews touched on that earlier, and actually, Dr. Wright, I appreciate you in your remarks to the chair. There are many, many more people who need this than what we're seeing in the state hospital. They're in the jails, they're in the streets. Representative Fitzpatrick in Pennsylvania clarified with CMS that home and community-based services does not preclude campus settings, intentional communities, and farmsteads. So we already pay for HCS, HCBS, AMH. Please go, when you're working on this, to those providers. I hear from them all the time, and there is a percentage of people that do not work out in that scattered model group home setting or in your apartment getting those services. So innovate within that. We can set up our campus settings because so many people, and you can go to like Down Home Ranch, an intentional community for persons with IDD, they have accepted people that they did not think would be successful, but because they had an intentional community, the behaviors were mitigated. That's what we're running into. We have all these people who do have somewhat expected behaviors, and they are not included in a community. So we have to set up communities. I would advise, look at every habitable building on a state hospital campus right now. We do need intermediate care facilities like we have on the IDD side. State-supported living centers fall under that, and I don't know anybody who does this work who doesn't always say, we need more state-supported living centers or something that looks like that, an intentional therapeutic community. So, Arizona has legislation. We talked about the forensic. They have not implemented them yet, but they're the first state to have the secure option within that 16 bed. And I've talked about this before. Collect your data. 190-day population under Medicare. You've exhausted your inpatient days. That's it. Lifetime limit of 190 days. Collect that data. That should be on the, okay, ask me questions, please. I'm so glad that you are talking. This is the best meeting I've ever seen. Please.
Thank you, Ms. Burns. Thank you.
Hi, Ms. Burns. It's good to see you.
Good to see you.
Can you please repeat the name of the different, I know the different therapeutic communities that you were talking about? I'm trying to write them down, and I know I've seen them before, but just to keep it fresh in my mind, will you repeat those again?
Are you talking about like what I referenced, Down Home Ranch?
Yes, but there were several others that you said in addition to Down Home Ranch.
Did I? I need my own transcript. I know of plenty. Yeah, and none of those are the secure option.
Right. Understood.
California.
And those are all on the IDD side, correct?
Right, so we need to be innovating.
Right.
Yeah.
Okay, I'm just trying to make sure that I can innovate by researching, so wanted to get their names again.
Yeah.
Anyone further? Ms. Burns, thank you, ma'am. All right.